Are you confused by Medicare? Well, you wouldn't be the only one. It is a complicated system. There's a few different parts of Medicare. There's many different plan options. There's some important timelines, and there's even some penalties you may not be aware of, which I'll be going over at the end of the video. When you're done watching this, you should have a pretty good overall idea of how Medicare works. I won't be going too in depth on the topics in this video. It's just a general overview, but I do have other videos that go more in depth on specific topics, so be sure to check those out. Now, most people are going to qualify for Medicare when they turn 65, and they're going to be required to enroll to avoid any penalties. There are a couple exceptions. For instance, if you continue working and your employer offers you credible or qualifying coverage, then you can delay your enrollment. Or if your spouse's employer offers family coverage that qualifies, then you can also potentially delay your enrollment. And also, if you've been approved for disability, then you can actually enroll in Medicare before the age of 65. However, most people, again, are going to be eligible to enroll at age 65 and required to do so to avoid any penalties. When you first become eligible for Medicare, there is what's known as the initial election period. This is a 7-month time frame that allows you to pick a plan. This is going to start 3 months before your 65th birthday. It includes the month of your birthday and goes 3 months after your 65th birthday. Now, I suggest to take care of this as soon as possible. As you go past your birthday, you start to run into potential gaps in coverage, and that's just something you should try to avoid. Some people will automatically be enrolled in Medicare. This is usually if you're already receiving Social Security benefits. There are a couple other situations that might apply as well. For more information on that, be sure to check out the video that goes into full details on how to enroll in Medicare. For those who are not automatically enrolled in Medicare, they would need to self-enroll. The easiest way to do this is online at the Social Security website, or you can do it by phone. In some areas, you may be able to go to your local Social Security office and do it in person, but with the ongoing pandemic, just make sure they're allowing in-person visits in your area. I'll put a link to the Social Security website in the description so you can easily find that site. Once enrolled in Medicare, you should receive your card by mail shortly after. Be careful though, because this isn't a hard physical card. It's really just a piece of paper. So be cautious not to accidentally throw this out. But this is going to be your red, white, and blue card. It's going to have your Medicare number as well as your start date. Most people's start date is going to be on the first of the month that they're born in. Unless you were born on the first of the month, then it'll be the first of the prior month. So if you were born June 1st, your coverage is going to start May 1st. Otherwise, if you're born any other time in June, then the coverage would start June 1st. So that's pretty much the most important things to be aware of as far as timeline and getting yourself enrolled and what to expect there. Now let's talk about the parts of Medicare. There are 4 main parts. There's Part A, B, C, and D. There's also what's known as Medicare Supplements or Medi-Gap plans. So first, let's talk about Medicare Part A and B, as those are coverages that work together, and that's what's known as Original Medicare. So Part A is going to cover your inpatient or hospitalization services. This covers things like home health care, skilled nursing facilities, even hospice care. So with Part A coverage, most people don't have to pay anything for this coverage, provided that they have worked at least 40 quarters, which is about 10 years, and they've made $1,470 per quarter. Now, if you don't meet those minimums, be sure to check out the video that I go into full detail about Part A costs. But again, most people don't have to pay for Part A. However, there is a deductible of $1,556. So that's the amount that you're going to have to pay out before any coverage starts. Now, once you do get into coverage, it gets a little bit complicated, again, how coverage applies. So be sure to check out my video that goes into full details about Part A coverage. Next, we have Part B. So Part B is going to cover your medical expenses. This is more or less outpatient stuff like visiting a doctor, getting lab work. Even medical durable equipment will be included in this, so that's like your wheelchairs and walkers. Now, unlike Part A, most people will have to pay for Part B. In 2022, the current premium is $170.10. Now, this is based upon income, and there's some special programs that may help reduce your cost for Part B, and high income earners will likely have a higher cost. High income in 2022 is defined as a single person making more than $91,000 or a married couple filing jointly making more than $182,000. Now, this is a tiered system, so the more that you make, the more that you'll pay. For more information about Part B cost and some of those special programs, check out the video that I have that goes into full detail about Part B costs. Now, in addition to the cost of Part B, there's also a deductible. This is $233. So again, that's the amount that you have to pay before any coverage starts. Once you do get into coverage, Part B is pretty straightforward, where it covers 80% of all your expenses. However, that leaves 20% on you to cover. And a big concern with that is that that 20% is unlimited. So there's no maximum out of pocket on this. If you wind up with $100,000 of medical expenses in the year, you would be on the line for $20,000. So this is a big problem that we try to fix with Medicare with some of the other products we'll be discussing soon. The last thing to point out about Original Medicare Part A and B is that there are no networks. This is nationwide coverage. So as long as the doctor or facility that you want to see accepts Medicare, then you can use the coverage there. And there's also no pre-authorizations required. As long as the services are covered by Medicare, you are able to use your coverage to do those procedures. So now let's talk about Medicare Part C. And this is where things get a little bit complicated. You might think of Part C as part complicated. I'd like you to think of Part C as part changing, as we would be changing from one system, Original Medicare A and B, to another system entirely. So Medicare Part A and B and C don't work together. Instead, Medicare A and B is one choice and Medicare Part C is another choice altogether. Medicare Part C is what's known as Medicare Advantage. And this is becoming more popular every year. You've probably seen commercials on TV about it from famous personalities. And the idea of Medicare Part C or Advantage plans is to leave behind your Medicare A and B or Original Medicare, which is government-sponsored insurance, in exchange for taking insurance from private insurance companies. And since these are private insurance companies and policies, they're going to look very familiar to insurance that you may have seen previously from an employer or your own individual coverage. These plans are going to have deductibles and max out-of-pockets and co-pays. So they help address that issue that we had in Original Medicare, where we have that unlimited 20% obligation. In an Advantage plan, you at least have a max out-of-pocket that you know the most you'll spend in a year is that maximum. Drawback of the Medicare Advantage, like other private insurance, is there are networks. And so in this situation, you need to make sure that your doctor is in network if you choose to take a Medicare Advantage plan. An appealing factor of Medicare Advantage is also that they usually offer plans at a $0 premium, so you don't have to pay anything extra for these plans, but you do have to continue making your Part B premium, which is at $170.10 per month. But as long as you're making your Part B premium, you can switch over to the Advantage option and get some of the benefits it offers. Some of the other things that they offer is dental, vision, hearing, gym memberships, meals, and transportation also as well. And while many plans are offered at a $0 premium, there are some other options typically where you can pay a little higher monthly premium to get lower max out-of-pockets, lower deductibles, or other benefits. Part C has two main types of plans, either MA or MAPD. So MA is just Medicare Advantage, where MAPD is Medicare Advantage with prescription drugs. Again, since these plans have networks, you need to make sure that both your doctors and your prescriptions are in the plan if you choose to get a MAPD plan. In the case that you find it difficult to find a plan that suits all of your needs, where it covers your doctors and your medications, you could choose just an MA plan and add on a standalone prescription drug plan, which we'll talk about here shortly. The other thing to be aware of is that of all those plans, you're going to have either an HMO version or a PPO version typically. PPO is going to be a more flexible plan with nationwide coverage, but even in that nationwide coverage, you may pay more for services outside of your network or out in the nationwide coverage. So these are some of the main things to be aware of with the Advantage plans that's different than your Original Medicare option. Medicare Part D is just a standalone prescription drug plan, and this can be added to Original Medicare Part A and B, or you can add it to a Part C MA plan. You would not be adding this to a Part C MAPD plan, as the MAPD plan already has coverage for prescription drugs included. Again, you may choose that MA plan with a Part D if you find it hard to get a network that covers both your doctors and your prescriptions all in that one MAPD plan. Part D usually costs around $30 to $50 per month, but you may have higher costs if you have more specialty medications. Again, use those 3 months that you have ahead of your 65th birthday to figure these things out. Part D seems fairly simple, but this is a complicated coverage topic. Be sure to check out my video that goes into full detail about how the coverage works, as there's some very important things to be aware of, especially what's known as a coverage gap or the donut hole. So be sure to check that video out so you understand, particularly if you are taking many medications. Now let's discuss Medicare Supplements, or what's known as Medi-Gap plans. There are about 10 Medi-Gap plans currently, and they also use a lettering system, Medi-Gap Plan A, B, and so on. Don't let this confuse you. This doesn't have anything to do with the other letters of Medicare. In 2022, Medi-Gap Plan G is the most comprehensive plan available. Now, unlike Part C or those Medicare Advantage plans that are often offered at a $0 premium, Medi-Gap plans will always have an additional cost. So Plan G is currently about $100 per month for a 65-year-old female and $120 per month for a 65-year-old male. So that's an additional cost to your Part B premium from original Medicare. So you have your original Medicare premium of $170.10 per month, plus your additional cost for your Medi-Gap plan of about $100 to $120 per month. So all together there, you're around $300 per month. Don't forget, you're going to want to add a Part D plan on as well, most likely, as you could face some penalties if you do not. Again, I'm going to go over that at the end of this video. So all in, if you were to go with the Medi-Gap or Medicare Supplement option, Plan G particularly, you're going to be around $300 per month. While Medi-Gap Plan G is much more expensive per month than just original Medicare or Medicare Advantage plan, there are some great benefits. Beyond your monthly premium, the only other expense you're going to have is your Part B deductible, which is $233. So once you meet that deductible, you're covered in full. Now, Plan G is not the only one, but as I mentioned, it's the most comprehensive. You could reduce some of your monthly costs by taking some other options that may be right for you. Everyone has a different need, so just be sure to use your 3-month time frame before your 65th birthday to really check all these things out and see what makes sense for you. Another important note with Medicare Supplement is that you only have this one option when you turn 65 to get the plan with no underwriting or no medical questions. So this will be different if you are apply for it in future years, as you can then be subject to medical questions and they take into account your health to apply premiums. So you could pay much more in the future than you would when you initially roll to Medicare. While all cases are different, my general rule of thumb would be if you have any major health issues that you're currently managing, I would go with the Medicare Supplement if at all possible. On the other hand, if you're fairly healthy and you're trying to keep your budget low, Medicare Advantage could be a good option. Just keep in mind, things do change. And while you may not need many medical services today, in the future you could. And if you want to change to Medicare Supplement in the future, it's likely going to cost you more than if you were to enroll initially at 65. The last thing to go over, as I mentioned at the beginning of the video, are those potential penalties. So with Part A, B, and D, you could face penalties if you don't enroll when first eligible. Now, Part A is not as common as most people don't have to pay a premium, so it doesn't really apply too often. However, if you are someone that does have to pay a Part A premium, you could choose to delay that enrollment and just enroll in Part B instead. And in this case, you may face penalties up to 10%. This penalty is going to last twice as long as you delay your enrollment. So if you don't enroll for 2 years, that 10% penalty could last for 4 years. Now, Part B has a much more significant, more common penalty, as most people have to pay a Part B premium. And with this penalty, if you do not enroll, then you're going to be penalized 10% each 12-month period that you're not enrolled. And this is lifelong. So that's where it's much more severe. So if you don't enroll for 5 12-month periods, you would end up paying 50% more for your Part B premium than you would if you enrolled initially. And again, this is lifelong, and eventually you may need to enroll in Medicare. So definitely be aware of this and take this fairly serious. Part D also has a lifelong penalty. The Part D penalty works on a formula, so it's going to be 1% for every month that you do not have the coverage, and that's going to be 1% of the national base beneficiary premium, which in 2022 is $33.37. In this example on the screen here, they're assuming that this person has been uncovered for 29 months, resulting in a 29% penalty. They take 0.29, which is that 29% penalty, times that $33.37, which is the base beneficiary premium, and you get a total of $9.68 as your penalty. They're then going to round that to the nearest 10 cents, which is $9.70. So then you're going to add that $9.70 to the cost of your Part D plan when you finally do get your plan. You may owe the penalty on Part D if at any time after your initial enrollment period ends, that there is a period of 63 or more days in a row when you do not have Medicare drug coverage or any other credible prescription drug coverage. Again, this is a lifelong penalty, so it is best to avoid this if at all possible. And that's why I recommend to take the Part D plan even if you're not on any medications at the time that you're eligible. Because again, you just never know when you're going to need to take medications. So it's best idea to avoid that penalty and get enrolled in a Part D plan. At this point, you should have a really good understanding of how Medicare works overall. Again, I'm not going in depth here as this is just meant for a general overview. So if there's anything that's still not clear or you have any specific questions, just add a comment below or you can email me directly. My email is listed in the description, along with a link to my calendar where you can set up a free 30-minute consultation to speak with me one-on-one about your particular needs. Also, be sure to check out some of my other videos where I do go into more depth on different topics about Medicare and other insurance products. And if there's anything that you'd like to see me cover, just let me know and I'd be glad to do that. I appreciate you viewing today. Thanks for watching. If you found the information in this video helpful, you know what to do.